is going on, everybody? Welcome to the latest episode of The Legislative Director, talking about legislative things. I got two people that I frightened just now.
Well, we're very close.
Yes,
so close in proximity.
I'm at the little chair today, which is fine. Legislative Director Amber Marr, not the Legislative Director Jason Thompson, and
definitely
special,
not the Legislative Director.
Special guest Anna Forster. Anna, who are you and why are you here?
So I'm Anna. I am a postdoctoral fellow in the IU School of Nursing. So I'm a nurse with a PhD, and I'm currently doing a legislative fellowship with the School of Nursing. So I get to work with Amber here at AARP to learn about legislative policy and what you guys do for the older adults.
Okay. So I really just dove in there. So thanks for going with it. But first, I hear IU School of Nursing, but your jacket says something else. Why are we wearing that jacket besides it being awesome?
So I got all of my degrees, my bachelor's, my master's, and my PhD from Purdue. So I'm a lifelong Boilermaker.
Boiler up. I love to hear that as a Purdue grad. And look, we're recording this after they've clinched their time into the Final Four. We're super pumped. And if you're not pumped, then I got nothing for you. I'm sorry. Just join us on this train, literally, because that's what Purdue's all about. You see what I did there? There we go. Boiler up. Here we go. Anna.
Oh.
You just spent a lovely session with us.
I did.
First of all, thank you for your good work.
I know.
You for
I was
your
just gonna
good
say
work.
Really appreciate you being here with us. Tell us a little bit about your experience volunteering with us this session.
Yeah, so I got to be a part of the volunteer legislative team. Got to be there for the coffee cart that I think you guys have talked about on this podcast.
Yep.
Really got to learn about what we can do to advocate for the older adult population. I was as I've been saying, a policy newbie. I knew nothing about the legislative process. Probably haven't read about it since the 8th grade when they teach you about it. So I really got to learn how I, as a nurse, and my role as a researcher and an academic comes into play, and how I can advocate for this population.
Which I think is fantastic. Plus, having you with us was just, I tell Anna this all the time. I think I learn more from her than she does from me. So it's just as amazing for us to have nurses alongside us while we're doing our work, because a lot of our activity is around health or livable communities, which is actually making sure people can stay in their homes and stay healthy in their homes and communities, et cetera. So it's a really important piece to what we do. So
what made you even interested in doing, like, getting in the mix at the Statehouse? It's not really something people are, like, clamoring to do.
Yeah.
I mean, there are people. They're weird.
Crazy people.
Like everybody at this table. We would classify as that. But what made you want to get in the mix at the Indiana General Assembly?
Yeah, so as a nurse, you learn from day one that part of your role, one of the million hats you get to wear, is to advocate for your patients. And they tell us, nurses should be involved in policy, but they don't tell us how. They don't give us those steps to get involved. So when I was approached by the School of Nursing and Dr. Crowder to be a part of this fellowship, I knew that I was going to learn a lot more about this process. And even though I don't plan on being a legislator in my future, but how I can support bills that support older adult health, how I can spread the word to other nurses, especially if it's topics applicable to their clinical practice. So I was really excited.
because what's the phrase? If you're not at the table, you're on the menu.
That is correct.
Oh.
That is.
So
That's what I hear.
We always like to make sure that anything that is in the medical field and addressing health professionals, that if nurses aren't at the table, they're not having that input for what they do as a career. And so that is why we also, as an AARP, I made it sound like we are like a thing. As AARP, it is very important to us that we are elevating healthcare professionals, specifically nurses, and making sure that they are a part of the conversation.
And part of our work too is focusing on social determinants of health broadly. So even looking at things like housing, access to food, travel, that kind of thing is important for nurses to be aware of too.
I love that you brought that up because I think we try to talk about this too, is that there is always, everything is connected, right? So nothing is ever in a silo. So if something's happening over here, we can connect it to here, and like you can bring it all the way full circle to know that like this is why it is important.
Yeah, because I think a lot of times nurses would look at some of the bills you guys worked on, like Senate Bill 52 or with safe housing.
Yes.
They don't necessarily think about those impacting their patients with direct health outcomes, but if they can't get to care, if they can't access their providers, they're not going to be healthy.
That is perfect.
He's just making those connections.
This is what we do.
That time, her time in the Indiana family just totally paid off right here.
I had great teachers.
Yeah, oh, see, Amber and then other people, because it wasn't me. So, Anna, we got some footage here of you doing work at the State House. So this is gonna have a "This Is Your Life" vibe to it.
Candid camera.
Which I don't even know if anybody is listening or hearing this would even know what that reference is, because I think that show was like even way before me. The "This Is Your Life" thing. You even know what I'm talking about?
Is it a movie?
No, it was a game show, I think, or a TV
This Is Your
show.
Life?
Yeah. Doesn't matter. We're not going to get bogged down.
You know what
on
I
this.
remember? I do remember the board game of life.
You know what? That was solid with the wheel and you had the little people.
Yes,
yeah,
and the little car
going around.
Yeah. So that I understand.
This concludes the nostalgia segment of our show, which we seem to be doing a lot lately, going way into the Wayback Machine. Anyway, for those of you that are not watching, what you're seeing on the screen, there's Anna talking with Representative Pressel.
Yep.
Who is the chair of the House Transportation Committee.
Mm-hmm.
So, which obviously you talked about Senate Bill 52. And then there's some other photos. There's, Anna talking with a volunteer, just hanging out in the chamber, the House chamber gallery, watching what's going on there. So there's a lot of good stuff that's happening at the State House that Anna was in the mix on. And just, how does that feel to see those photos? How does that make you feel?
It's good. I like the one with Representative Pressel, because I actually got to meet with him a few times with Amber and talk to him that day. And I don't think I realized how personable these legislators are. I kind of had them on a pedestal of, they don't want to talk to me, they're not going to listen to me, but they were great. And I think Representative Pressel even asked me about how my fellowship was going. He asked me if people were being nice to me. So it was great.
That is one of the things that I love when folks come to the State House, because I think that there is this big feeling of like, I can't talk to them because they, this and that. And really, they're just like us.
There's people.
Yeah.
They are people.
And Representative Pressel, absolutely, when we went to talk to him about 52 before the first hearing of the bill even, he was so interested in hearing about Anna's experience and like what she was doing. So I think then the next time when we were all over the State House, I think you had him to call him out of session.
Yes, I did.
And he came out and remembered her. And, I just think it's really great for people to feel that way, because that's what our legislators are there for, is to be able to talk and converse and share our beliefs and, concerns on things.
One would hope that the legislators are people. And I'm glad that they are.
People, not robots.
They're not robots. Though some may act like it. They're actually people.
Oh, I was just going to do that commercial that I tried to do the other day about robots, but nobody knew what I was talking about, so I will not do it.
You could do the robot right now. We could pause for a second. So that's for those of you that aren't watching, you might want to see this.
I'm not going to do the
Check out
robot.
the video.
Like, subscribe, tell your friends.
I'm not a robot.
Okay. Well, all in all, thumbs up, thumbs down.
Your
do it again.
experience.
I'd do it again.
Yes.
I do it again, and I tell my friends to do it too.
Good, because it would have been awkward if you said no.
She was like, I would not, no recommend.
Hard pass. Well, we appreciate the work you've done this session, the work that you're going to continue to do.
Well, sorry.
We're going to get it. We're not going away. I was just going to ask. So session's over. And
No,
you're doing...
I know. I need to say something though really fast.
Okay.
We need to give a shout out to Dr. Crowder.
Oh,
there
for
we
sure.
go. That's a good point. Yeah.
Because Dr. Crowder first of all, AARP would not be having this experience without her. And I know that, I don't know if Kate was on last year, because Kate was with us last session. And I don't think she was on, but you saw pictures, etc. This is our second year really engaging this directly with the IU School of Nursing. And it is just, we are we're very grateful. It is wonderful, and our volunteer legislative team members that Anna is a part of also has enjoyed it so much. So I wanted to make sure we said that.
That's a good call out.
Maybe in the future you can do a "Where Are They Now"
Yes!
podcast episode.
Ah,
Yeah.
what? Look at
Look
these
at that.
ideas.
Still paying off. Look at this.
Like I said,
Uh.
I'm learning more from Anna than she is from me. But that is a great idea.
We'll get a reunion show going.
Because
you know.
I know Kate does watch these.
Yes.
So this is a great idea because we could do Where is Kate Now?
Yeah.
Because Kate is doing great things.
She's doing
So,
good things as well. Look,
yes.
just so proud.
Yeah. So
Watch
anyway,
it just
sorry,
leave the
I wanted-
nest
Proud
and do
parents.
things.
I
Yeah.
wanted to make sure Dr. Crowder had
Yeah.
a shout out from
Shout out
us.
Dr. Crowder. Appreciate the hard work that you're
Yes.
doing and bringing nurses into this advocacy and
Yes.
policy space where they need to be.
I mean,
And
she is such an advocate on making sure that folks understand the legislative process.
Mhm.
It is unreal because she knows how important it is for nurses to have exposure and experience in this area.
And she's also showed us how some of this policy affects us as nurses who are in the academic setting. Because there's some legislation that's been going on about tenure with faculty and things like that. So she also brings that side in too.
Absolutely. It literally, legislation can touch any career path
Mhm.
that almost anyone takes, specifically in the nursing area.
Mhm.
So yeah.
so
So
session's over.
I apologize. I
No,
didn't
no,
mean to
no.
interrupt you, but that was part of what we
You
were talking
interrupt
about.
me whenever you like. Because that was a good call out. Besides, so session's over.
Oh, yes.
You do other stuff. What is some of that stuff that you're doing?
So as a nurse with a PhD, my main focus is doing research, and obviously with the older adult population. So I do work looking at how your mood and your emotions impact your physical activity. But I'm doing this with the older adults. So currently I'm working with older adult farmers in Indiana to look at how their mood and their emotion impacts their activity. I'm ultimately looking to specifically help with cardiovascular outcomes, so things like heart disease, hypertension management, that kind of thing. But as a postdoc right now, my goal is to eventually move into a faculty position. So I'll be doing research and then teaching as well.
Okay, and we got some information we're going to put up there.
Yeah.
There's up there on the screen.
Yeah, so if you know any farmers over the age of 65
Yes.
that want to wear an activity tracker, it's like a Fitbit, just monitors their movement, send them my way.
And I feel like I've asked you this, but
Yeah.
how long can you take folks? How, as people are interested or, wanting to reach out to you, how long can they
So
do that?
right now, it's an open date.
Okay, great.
I have funding through this fall, but I'm looking
excellent.
to acquire about 20 people. So this is what they call a feasibility study. So I'm looking to make sure farmers can wear my activity trackers, that it works well with them in their daily lives because they are out doing manual labor. So I'm currently still enrolling, probably will at least through the end of the spring, I would
Awesome.
think.
Perfect.
All right,
Well, if you're interested,
yes.
Hit me up.
Information is on screen for those that are listening. Seek this out on YouTube or reach out to us, and we'll get you in touch with Anna,
Yeah.
so that you can help her with her research project. I guess it's not really a project, just research in general. I made that sound like you're like
It is a
in
project.
elementary school. So I
Well, my
apologize
friends
for
still
that.
tell me when I present posters at conferences that I'm just going to adult science fairs. So
Look,
you're not far off.
You know
adult
what?
science fairs.
it's the
That sounds amazing.
you can only go to that volcano with the vinegar and baking soda so many times, right? Or a solar system. So good. You like good for you.
I had the bug collection.
The bug collection.
Mhm.
Interesting.
Maybe I'll have to make a diorama.
Yeah.
Yes. Okay,
for
great.
my next
Always
one.
could use a good shoebox. That's why you hold on to them. For
Yes,
that exact same
exactly.
reason.
Exactly.
Well, thank you so much.
Oh, now it makes me want to go to a science fair.
Look,
You can come.
you both
No,
get
I want to
you
go.
both get blue ribbons in my book.
Aw,
like-
thanks.
Thank you.
See, I thought you were gonna go with the eye roll there, and I
What?
appreciate it.
I didn't know, so I was like, thank you.
All right.
So
Well,
nice.
thank you.
Yes.
You know what? What else do we want to talk about? What else is going on?
Oh, well, I'm trying to think. Is that all that we want to?
Anna, yeah, is there anything else you
Is
want
there
to
anything else that
add?
you want to share
Yeah.
that we haven't asked you, or something that you want the audience to know?
Just something that's really been bugging you that you just want to put out there?
Or something about me that she's like, you're never
Just air
gonna
all
get.
my grievances
Yes.
now. live
Look, that's
online.
great content. So, as they
No,
like to say.
I think the only thing that I would say is if you have any interest, not only in policy, but any of the issues that are going on, it is so easy to get involved. That is something I didn't realize either. even if you're not at the State House, watching some of these hearings online. If you want to come to the State House and testify, you can do that. I didn't know that either. So it's easy to get involved, and I think more people should.
That is an amazing takeaway, because I feel like that is one of the things that we continue to try to tell people, is that it's really not that hard to get engaged.
Mhm.
Maybe finding some of the information is a little wonky, like making sure you
Mhm.
know where it's at. But once you can find that, you can do almost anything online that you
Yes.
could do at the State House. Minus testifying. I
Yeah.
know that they make you be in person,
Mhm.
but at least you could follow along.
Mhm.
So thank you for saying
Yeah,
that, because
of
I think
course.
that is one of the things that we really are trying to instill in folks, is that it's so important to be engaged, but it's also just super easy to get there.
Agreed.
So
So great advice. Get in the mix if you
Yes.
can, because what's happening over there has a big impact on your and
does.
often sometimes on your day-to-day life. So it's important to be involved in that.
And I want to make sure, even though he's behind the screen, Dan also tries to let our volunteers know this on the reg. So
Yes.
Yeah.
Absolutely. And then if you're interested in volunteering for us, we can get you hooked up with that as well.
Yeah.
Come join the
Yeah,
legislative
there you
team.
go.
Yes.
Let's do some
We're
stuff.
trying to hold on to Anna as long as possible.
Yes.
So.
Look, she's in it now. There's no backing out. What else? What other updates
yes.
we want to give some folks? I think we got a couple of things that we want to touch base with. Some housekeeping, if you will.
So I wanted to say if people watched the last episode,
And you should have.
I was like, there's something else. And then I was like, I'm forgetting it. Okay, well, guess what? I remembered. And the show had already ended. So thankfully, I had this week to talk about it, but I wanted to make sure everyone knew, and I think you can still sign up. But the Prosperity Indiana is having their summit April 9th and 10th. So please, if you are interested, we are going to be attending. They have wonderful sessions. Most of the sessions are on April 10th. But I just wanted to say that because I totally forgot to mention that last time.
Okay. I'm glad you remembered. I mean, it was like immediately after the show ended.
It really was. I was like, and then it was
we
too
weren't
late.
going to record that again. So thanks for getting that back in now.
It was too late.
You made up for it now.
Mm-hmm.
Anything else?
Do you want to tell them what that covers? Because I don't know what they talk about there.
Oh, yes. See,
this is what we're talking about.
Anna might become a mainstay on the show.
Yeah, I might be finding myself out of a job.
No.
Anna and I take over. Sounds like a good idea.
Look, this is the most
See you
excited she's
later.
been at this show in a while. The prospect of me not being on it.
No, I didn't say that. That's a joke.
It's not.
Okay, so that was a great question, Anna. Some of the sessions, so their summit this year is around housing. And so a lot of the sessions are going to be incorporating some type of housing issue, which I'll just name a couple. There is one for the role of owner-occupied repair in affordable housing. These are things where the owner-occupied repair is to help keep people in their homes. So what can be done to help them stay in their homes and communities? Like do they need a ramp? Do they need, et cetera, things like that that can be fixed on their home to help keep them there. Regional landlord engagement strategies. There's a lot of talk around landlords, and some of the landlords are actually members of Prosperity Indiana. So that's why it's really important for us to understand that when we talk about landlord issues, that we're actually not, we're not trying to harm great landlords. This is really a lot of the things that we're talking about are supposed to be aimed at landlords that are not doing what everyone else is doing. Right?
Correct. Yes.
So let's just see here. Another one. Winning with missing middle housing. We talk about this a lot, even from an AARP perspective. The different types of housing. What does that look like? Are there enough of, housing across the board? That's kind of what we say, right? So missing middle would be like, I'm not going to be able to say this very eloquently. Duplexes, triplexes, things like that.
ADUs.
Yes. There's another one that says, let me just make sure here. Oh, land banks. Prosperity, while AARP Indiana has not specifically gotten engaged in land banks on a state level, Prosperity Indiana has definitely talked about land banks. So that is something that I think would also be very interesting for folks that would like to hear more about that. And then we'll just pick one more really fast. Let's see. Improving equity in tenant selection through low barrier screening. I don't even really know what that's going to be about, but that's why
Sounds interesting.
it sounds great. So obviously there's a session for everybody, and it is going to, I think, be very interesting for us to kind of see what is coming down the pike, even though we've been working on a lot of these issues for a number of years and have not really made a lot of movement in the State House. But that's why we're doing this.
All right, so remind folks once more the dates on this.
Yes, it is April 9th and 10th, but the majority of the sessions are on April 10th.
And this is taking place at Indianapolis at the Marriott North.
Yes.
Okay, so the folks on the north side of Indianapolis is where you'll need to go and where it's happening.
Yep.
Okay.
And we are a sponsor, that's why.
Cool.
Just because we are huge advocates of working and partnering with Prosperity Indiana on what they do.
And especially when we're talking about housing, as we just said, that was a big issue for us.
Yep.
All right.
Thank you for asking that question.
Yeah.
Continue to do good work.
Let's see.
I'm trying to get an invite back.
Look, it's an open invite whenever you want to come back.
Yes.
You might guest host one day.
Just a reminder that we are not quite there yet with our video voter guides for the upcoming primary, but we will be
coming soon.
Yeah, we will be letting you all know when it's posted.
Yep, we'll let you know when those are live, but we've recorded them, kind of putting them all together now. Looking forward to getting those out there in the world very soon. Reminder for those of you, if you're not registered to vote, you have until April 8th to get that done. And then early voting starts on April 9th. So you'll seek wherever your county clerk's office or what other early voting opportunities you may have in your county. Just seek that out, and you can vote for May's primary as soon as next week.
And I know that we kind of did this rundown on our last show, but give the website one more time.
AARP.org/INVotes. That'll get you all the information that you need around this upcoming election, with links and all sorts of things about what you need to vote, how you can go about voting, et cetera, et cetera. So check that out. That'll give you some good information about what you need.
I was just checking one more time to make sure that there was nothing scheduled for because Legislative Council will be meeting soon.
Okay.
And I am just constantly checking. No, it's still last year's.
Okay.
I'm just constantly checking because it's going to come very quickly, even though we just entered April, but they should be meeting coming up. So
stay tuned for that as well.
Yeah.
Okay.
What else are we forgetting, Anna? Anything?
That's it.
I think that's it.
Dan,
I don't think we forget anything. You can put it up on the screen, whatever you're thinking or feeling.
Whatever he puts up, we'll talk about it.
Yeah, exactly.
Well, this sounds like a very crazy improv opportunity.
Just another quick reminder, because I don't think we'll have a show before this happens either, is just, I know we said it last time too, but the Behavioral Health Commission.
Yes, Behavioral Health Commission, April 10th, 1 until 4.
Yes.
That is happening at the State Library downtown Indianapolis, looking at the intellectual and developmental disability population and their needs.
That can be watched online?
Yes, and it's FSSA's YouTube page is where that will be live streamed. So seek out the FSSA's YouTube page. I don't necessarily know it off the top of my head, but should be able to find it there. And that's where it'll be live streamed.
I think I was just making sure I was going through my...
Clearing out the notebook. Love
it. I was just making sure I wasn't forgetting something this time.
Well, I think
that's good.
That is it.
Yes.
Anna, thank you again.
I know.
Thanks for having me.
Thanks for being here.
And everyone, please enjoy the eclipse.
Yes.
The eclipse is coming up a week from yesterday.
Yeah,
we're recording this
Monday.
on Tuesday.
Yes. I just wanted to make sure, because we talked about it last time, but we will be able to talk about the eclipse the next time we record.
Wear proper eyewear.
And you know what? I saw something about how to test. I'm very worried that my glasses are not real.
There's some sort of serial number or something on the inside, I think.
Oh, they were trying to tell you how to test it. So I was going to have to.
You could do that too, I guess. I don't know. I thought there was something like some sort of branding on it that you knew that these were legit.
Oh, I'll have to look it up because I am very nervous. I'm like put my glasses on and then it's going to look like.
Well,
I'll let you know.
Let's do that research before we look at it. That'd be good.
You know, there's all this stuff out there
Look.
about glasses being fraudulent.
You got to make
So
sure.
I'm
And then
skeptical.
it's also, look, if you're going to be in central Indiana when this is all happening,
Yeah.
they're preparing for heavy traffic, telling you to make sure you fill up your car with, it's like a snowstorm's coming.
Hopefully we can have some B-roll if that really happens. I'm going to try to get some photos.
Try to get some
Ooh.
photos and whatnot.
Yeah, if there's traffic or the grocery stores, I'm going to keep an eye out for that too.
This is going to be good. I can't wait.
All right, we can wrap up.
Yeah, well, I think we're all done here. Thank you so much, Anna, for your hard work.
Thank you.
Amber, as always.
Thank you, Anna.
And for those of you, boiler up.
Oh,
Yeah.
yes.
We got the first of the final 4 games this weekend. We're excited.
Get
Fingers
ready.
crossed.
And
Yes.
hopefully, for those of you that aren't Purdue fans, that's fine. Come along for the ride for a little while. It'll be a good time.
Because next week, what we could, well, I'm not going
We're not going to talk about it.
Yep.
Hopefully, we just,
to just be a surprise.
yeah, we'll see what happens. We'll see what happens. So stay tuned. Thank you as always. And we'll see you next time on The Legislative Director talking about legislative things.
Bye.
Bye.